when you have, good speakers and good people like this to take the lead, there's not too much I have to say, except to introduce two of our own. We are fortunate to have two of our own people who are going to dive into, mental health, especially for seniors. And I think we were chatting. I said I went to Opokuwari and I was taught that it's always ladies first. So I will start with Dr. Edna Ayi. Dr. Edna Ayi completed her PhD in clinical and counseling psychology with specialization in forensic psychology from the University of Toronto. She worked with several government institutions, including Corrections Canada and CAMH and Ontario Shores. She is currently a registered clinical traumatologist, physiotherapist, and an executive consultant. We are blessed to have you, Dr. Edna Ayi. And I'll go to one of our own as well. Dr. Charles Ohene Dakon attended Opokuwari School and received his medical education from the University of Ghana Medical School, followed by specialization training at the University of Cambridge in England. He is an assistant clinical professor at McMaster in Hamilton, Toronto Metropolitan University, and our very own University of Cape Coast in Ghana. He is also a psychiatrist at the William Osler Health Systems. I think for now he works from the Brampton, Brampton Clinic. Sure. Dr. Ohene Dakon has a keen interest in mental health and the law, and he is very passionate about mental health, especially when it relates to people of the African origin. Outside of medicine, he is a father, author, entrepreneur, and a philanthropist. Welcome, Dr. Ohene Dakon.
Dr. Ohene Dakon,
thank you. Thank you so much for having us. And we are actually very cherished to have you invite us. Last week, one of the doctors in the hospital was showing me some stuff that you had done. I think it's first aid mental health training, and they were very impressed, and I was very impressed because I didn't even know that the Ghanaian Canadian Association of Ontario had started doing first aid on mental health last year. So anyway, I'm happy to be here.
Thank you. So without further ado, I think we will have Dr. Edna Ayi start.
Okay, thank you so much. I'll also say in a humble way, it's a pleasure to be here. And it's always a delight to work with the Ghana Canadian Association. Mary has a nice way of pulling us in. And so I worked, and I'm still part of the Black Mental First Aid, and I train a few people at the center there. Mary was one of the co-facilitators, so it's a pleasure, and I cherish you inviting me, all the seniors. So from a personal standpoint of view, I was I'll say the bulk of my life, I lived with seniors. So my grandparents and her parents, unfortunately, they've all passed, but they lived to be centurions. And then now I have to say, pleasure to be taking care of my mother. My dad is passed, so aging is part of the human existence, and it comes with its own blessings and challenges. And from the personal point of view, what I would say is that it comes with a lot of patience. a lot of patience, a lot of understanding, and a lot of empathy, because it's part of us. So thank you so much. So a little disclaimer here. I think the presentation here is not meant to diagnose anyone or put a label on anyone or to tell somebody that there's something wrong with you. It's just an education. And if you need any follow-up, we would suggest that you talk to your family doctor or you talk to geriatrics in the community. I used to practice as a psychologist before. I don't, for some time, I've been doing more of research and then consultancy with companies. Maybe in the near future, I'll come back practicing, but this is a topic that I'm passionate about when it comes to the human brain. And so I will just go ahead with the presentation.
Okay, before you start, okay, everybody, please mute yourself. And if you have any questions, you may write it down or post it in the, post it or keep it. And when the presentations are over, you raise your hand and you will be asked to ask your questions or post it in the column below. Thank you. Go ahead.
Okay. I'm trying to move the slide. Okay, next. So I just simplified it. And we're going to look at how aging and memory kind of affects our lives, the causes of memory decline, and then some strategies that we can use. So Dr. Charles would also chime in as I present. That's okay. So I brought this for you this picture for you to take a good look at. I think there's a bit of stigma or there's a fear or some misinformation that the brain is something that is so abstract. But the brain is part of us. And I think as Black people, particularly Africans, we've not been taught so much. We don't talk about the brain. But the brain is part of us. It's part of the body that we carry every day. So I kind of brought this. I carry this everywhere I go to do a demonstration, similar to the picture, if you can see, right? So it's something that you can hold, something that you can leave. It's an organ and one of the most important organs, in the human body. So the picture there is showing us the different parts of our brain. And as we are born, certain parts of the brain develop faster than others. And then as we get older, certain parts of the brain also get more affected than others. So interestingly, the frontal brain, which is like the blue part of the brain, this part of the brain, which is like 80%, of the brain, controls the executive function. Unfortunately, that one develops later, or like fully develops like in the mid 20s. So if you look at the back ones, those ones actually develop like the hindbrain, the stem brain, and the amygdala, then where you have that red parts, and then the temporal lobe, which is where memory is stored. Those ones kind of develop very fast. But when it comes to decline, interestingly, the frontal lobe, which is like the executive functioning parts, gets affected. You could see the decline in a lot of people because that part is for, like your facts, your semantic memory and kind of deep knowledge. So if you pay attention to your own self, you could see that part of your brain functions better than others as you are growing older. I don't know how, nature and science got to do that, but the interesting thing is that the environment gets to shape, significantly part of the brain as you're growing. So like I said, even though the frontal brain, which is like the executive functioning from 0 to 25, is being shaped by the environment and the adults in your life and culture and beliefs and system, the temporal lobe, or kind of the other parts of the brain, which stores more of your stories, your episodic kind of memory, your trauma, your challenges, as a kid, your emotions, those kind of develop fast and they are stored there. So as you're growing older now, all these parts of the brain get to interact with each other. So having said that, now you are getting old and you're seeing changes. So somebody might define what is age and memory. So if you look at research, they always say like you look at 65 plus, then you start seeing like significant decline, but sometimes when I'm chatting with some like older siblings who are like in their 60s, and I can see them repeating statements, and I'm like, I thought my grandmother had a very sharp brain and we inherited, a very good retentive memory. So that tells me that maybe the life challenges they face, the difficulties may have affected part of their brain, but they are not aware that they've told me the story like 6 times in a month. Anyways, so aging is a natural biological process that affects all bodily systems, including the brain. So one of the most noticeable cognitive changes associated with aging is memory, right? So I've given you like a very snapshot of how the different parts of the brain work. So if you want to say once again, the brain is divided into 2 parts, the left and the right, okay? So the left and the right, they have the same function, like I said, they have the frontal lobe area, they have the temporal lobe area, they have the stem area, they have the occipital area. And then when you come to the right has the same. And you look carefully, the right has a specific function, the left also has a specific functioning. One is for language, one is for logic. So if you are aging, you realize that maybe your logical side, which is like more like your left side, maybe you can't remember facts anymore, but then your language side is kind of also in tune, or comprehension is in tune or whatsoever. But memory here says that not everything remains the same. Some things will change, some things will remain the same. So when it comes to logic, it comes to language in the left brain, most of the time you see a bit of changes. And then you look at comprehension on the right-hand side, or let's say some executive functioning on the right-hand side, there might be some decline, there might not be some decline, but it all depends. Some people tend to do very well in both areas. However, whether you like it or not, from what I have noticed, part of the brain tends to be, sharper or decline more than the other one. I don't know which part, but I've seen that the logical brain is affected more. Maybe language is intact, episodic brain like your stories, things about your childhood. Some you may remember, some you may not remember. So these are all factors that affect the human brain, and it's not due to anybody's fault. It's just how the brain functions. Another thing that I want to bring up in the introduction here is that when we talk about brain issues, people tend to look at traumatic brain injury. So traumatic brain injury is like there is a force on your brain, maybe due to an accident, maybe due to a fall. So as seniors, you know that like falling is very common. So when you fall and you hit a certain part of your brain, that can, cause either a concussion, or you go into coma, or, a different type of brain injury. But that's not what we're talking about here. So what we're talking about here is that changes that affect your brain due to aging. So you may not necessarily fall on the ground. You may not be involved in an accident. You may not have ever experienced coma, but because of age, there is a decline. There is some kind of impact in your memory. So that's the focus here. So I just wanted to also clarify that. So people get confused with that type of brain injury. So it's not traumatic brain injury. So somebody can have a traumatic brain injury. Maybe they will fall, they'll have an accident, and may not necessarily have dementia, right? But this type of memory challenge comes with aging. It affects all of us. So again, I would say that it's the noticeable cognitive changes associated with aging. So the changes that you are seeing because you are now aging, we are now aging. So that's what we're talking about. So from what Mary said, she's like, focus on dementia. So I'll focus more on dementia. Okay, so dementia here is an umbrella term for a set of symptoms affecting memory, thinking, social abilities, severely enough to interfere with your daily life. So here it's saying that anytime you think of dementia, you're talking about a set of symptoms. So like a cluster of symptoms. It's not just one thing. So different things that affect your thinking, your social abilities, and then your daily life and your thinking or your memory. So dementia comes out of, let's say, Alzheimer's. It's like one of the maybe babies of, Alzheimer's as well. So there are different types of dementia. And here, my next slide will show the different types of dementia. So we have Alzheimer's disease. We have vascular dementia, Lewy body dementia, frontal lobe dementia, Parkinson's dementia, Huntington's dementia, and then Wernicke's dementia. So I try to pick the common ones. There could be more. So let me close this so I can see. Yeah, there could be more. So the Alzheimer's disease one, if you look at it, mainly like there are plaques. So there's loss, memory loss, there's confusion, language problems. I don't know if somebody's writing. Confusion, language problems, and disorientation. So when we say memory loss, and a typical example for seniors could be, I place my car keys, there, and I don't know where it is. I put my jacket, or I gave my grandchildren some money, and I don't remember how much I gave them, right? So there's confusion. Oh, I don't remember if I visited that place last week, or even with confusion with directions. Places that you could easily remember, now you're struggling to find a direction. And then I talk about the language problems, and then disorientation as well. So kind of not sure, not convinced, about the facts. You seem to be a bit disoriented in a situation. So here we say that it's very common, it is very gradual, and then it worsens over time. So if you look at yourself, you can say that maybe in your 40s, in your 50s, you used to kind of drive around without even using a map or a GPS, things offhand. Now, both sides of your brain, your left and your right, your comprehension side is intact, your logical side is intact. But now you're realizing that, no, this is quite difficult for you. And so you look at the vascular dementia, they're saying that this could be due to stroke, blood flow to the brain is blocked. And this type of dementia seems to be more common in men than women because of vascular issues like heart-related issues. It affects you looking at poor judgment, poor planning, slow thinking. And if you look at the typical onset, it is sudden. And after a stroke, it may progress. I don't know if you witness anyone with stroke, but you could see that if it is, there are different types of stroke, but if it's kind of a stroke, that unilateral one maybe affects one part of the body, you can see that part of the brain, it's affected. And so the other part of the brain have to kind of compensate for the other part. We have the Lewy body. I would skip that. That one, I don't know. I haven't seen anyone with a Lewy body, but I've seen this first too. Maybe as we go on, Dr. Charles might add his 2 cents. But I've seen that the frontal temporal lobe dementia one too, which seems to be quite common. There's like the prefrontal damage, which is like the executive part of the brain. The temporal lobe actually stores like memory, more of the declarative, implicit memory. So like you have to put in effort to remember things, if you want to add, let's say 1,000 CDs to 951, you have to add temporal lobe, or you have to go back more also to episodic memory, things that happened in the past, or very specific details of an information. So these parts of the brain, I've seen it, the frontal temporal lobe, more affected. So you find changes in your personality, inappropriate behavior, language issues. And if you look at the onset, so it says the younger set is 40 to 60, and then memory may be spared early. So this is where it starts. So you start paying attention to that. And then the Parkinson's, dementia, are kind of, one key thing when you see people with Parkinson's is you look at how they move, there's kind of movement, they shake a little bit. There's memory loss, slow thinking, and then movement issues. The difficulty in holding things, difficulty in touching things. So I'm thinking that if you're asking them to remember something that they've done, it is actually quite difficult for them. So typically develops after, Parkinson's diagnosis. So if you don't have the Parkinson's, diagnosis, it would be difficult for you to have this type of dementia. Similar with Huntington's disease, they go together. So I think Muhammad Ali, we all know him, had Parkinson's to some extent. Now they're saying Joe Biden may have early symptoms of Parkinson's, and people are wondering why the doctors hid it from the public, and they're investigating it. So we also, people were calling him Slow Joe. So this is what you can see, Slow Joe in his thinking. Now Huntington's, which is like inherited genetic mutation. So I have to say that these things exist in our culture, but we don't talk about them. They are like taboos, but they are just there, So as we have this, you can now pay attention. So we have the Huntington's also has like movement disorders. You see more of like, I don't know how they say, like a mask face, usually with them. There's cognitive decline, mood issues. Yeah, so they have like a very mask. You don't know if they are smiling or very rigid face, but that's how it is. Symptoms starts between 30s and 50s and progressive, and it's genetic. So if there's somebody in your family with that, there's a chance that, you might inherit that. And then the Wernicke's-Korsakoff, which is like a thiamine deficiency due to vitamin B deficiency, often from alcohol use. So this affects your brain. And this Wernicke's actually affects more or less like your right side of your brain. And it says severe memory issues, confusion, poor coordination, treatable with thiamine, and this, you definitely would need like a medical intervention for most of these diagnoses. How are we doing?
Very well.
Very, very well. Very well.
Okay. I don't want to be like I'm lecturing, but it's just how my brain also works. That's
No,
why I did the PowerPoint, so I'm not all over the place. Okay.
you are giving us the right information. Go on.
Okay. Thank you. So these ones are very common. I'm sure Dr. Charles, he sees like patients from Kolebu or and he as well could see that, okay, this is how you diagnose and this is what you have, So like I told you, these things, they exist, they're there in our community. So we'll go on to the next one. So the key thing here is that they start affecting our memory. So I want us also to look at the types of memory problems that we may have. Some are common, some are not really common, but they all come along with aging. So here we have like normal aging and then possible demential memory problems. So as you're aging, you have this issue. So I'll go through the types and then we'll look at the two here. So here, short-term memory. So often declines slightly with age. This includes remembering things like a phone number that you just heard or where you placed your keys. So let's say somebody repeated a phone number to you a few times and then you still can't remember right? So you want to pay attention. You want to ask yourself, why can't I remember, this phone number, right? So when it comes to intervention, what we say, you chunk the numbers. You can chunk the numbers into 5, or you chunk them into 7. Some people chunk them into 4, some people chunk them into 3. So if you look at our phone numbers here, 647, then 647 is like constant, or 416 is constant. Then the last 7, you can say you chunk them into 3 and 4, right? So you can chunk them like that. It helps you to remember. So that's one way of chunking things or numbers. Another way, you can use acoustic way. Acoustic is like you're trying to use sounds and symbols, So people have different ways to. So this one happens to all of us. If you also like maybe tell people names, some people are good with remembering names. I can remember a few names. I can remember all names. Maybe I can remember like 7 or 8, but I can remember more faces. Now we have episodic memory. So remember what I told you, the episodic memory is in your temporal lobe, right? So that temporal lobe place stores a lot of our stories, a lot of the memories that we've had. So the episodic memory involves recalling personal experiences or specific events. So it requires a little bit more of effort. So if I ask you, do you remember the birthdays of all your grandchildren or the birthdays of all your cousins? It might be a bit challenging. Some people do. Or if I asked you, there's something we call reminiscence bomb. So the reminiscence bomb affects a lot of seniors, where your brain, this episodic brain here, memory, will get stuck between the ages of 15 and 25. And it will remember a lot of things that happen between, 15 and 25. And then the person will be ruminating, and it creates a lot of chaos. So as we go along to prevention, there's a way you can overcome that, but you pay attention, ask yourself, am I forgetting things? Am I forgetting things about my own story? My own journey. When I went to Pokuwari, or when I first came to Canada, these things tend to decline with age, and sometimes we think seniors lie. That's why I said you have to work with seniors with patience. So when I'm listening to my own uncles, my own aunties, and my own parents, and initially I'll be like, oh, but are you telling me that? But I realize it's the brain. So I have to be more patient with them. They are not lying, they just can't remember.
No, but it's good for him to, yeah.
Somebody saying something, please.
I've muted them.
Okay. Yeah, so in recalling episodic memories, we have to be patient, with ourselves, with our seniors. With age, you can't remember everything. Now, semantics. So semantics deals with facts. It's also in the temporal lobe. So it's part of your declarative memory or implicit memory. You have to put in the effort. You have to look for the facts. So here, capital of cities, the meaning of things, trying to explain things step by step, trying to, go deeper into calculating things by, as you get older, they become quite difficult. So we say that usually remains stable or even improves with age. So as you are every day putting in the effort, it stays with you, right? So we all know all the capitals of Ghana until they added the new regions that, since we were not there, we can't remember, but we can remember the 10 that we knew. So that's kind of semantic. We can convert a dollar to a CD. We can calculate a few things. But if you don't put in that effort, one thing with implicit memory, you lose them. I don't know how many states are there in the US. Can you remember all the names of the states? Now, procedural memory. So this one is kind of my favorite because by God's grace, as we get older, it stays with us. So you ride a bicycle, it stays with you. You know how to braid hair, it stays with you. You know how to make food for young people or older people, it stays with you. You know how to iron your clothes, it stays with you. You don't lose some of these procedural skills. Even what you've learned, if you are even like a retired doctor, a retired police officer, all these memories, they stay with you. They're part of your daily, lifestyle. We don't lose that easily. Then you have the working memory, the ability to hold and manipulate information in the mind. So doing mental math, weaken over time. So like I said, you can use like the chunking. So let's say you sit down to actually read a document, and then you want to go into the working memory. You want to push your brain a little bit to say, what is the meaning of what I've read? So you're kind of engaging more or less like your prefrontal cortex, this part of your brain, to be in the working memory, because if you don't engage the information in the working memory, you might lose them. It might easily go into the short-term memory. But the whole idea is that as you work in the working memory, it will go into the long-term memory. You store and then you can retrieve so you don't keep repeating yourself. So now let's look at, memories with normal aging and then possible dementia. So occasionally forgetting names or dates, it's normal. So we're not saying that you have to remember everything. So the moment you realize that, oh, I can't remember something, then it means that, oh, I'm having dementia. I read, oh, Mary, can you refer me to a doctor that can help me to diagnose, or you call your grandchildren? No, it is part of us. Young people also forget. But as you get older, you say that you frequently forget important information. So like I said, this older sister of mine, I don't know how to relay this to her, but she lives in the UK. She'll call me and she'll tell me things like 6 times. So I don't want to say that, even me, I'm even struggling to relay that to her. Like, I think you're forgetting that you're telling me the same story like 6 times in a month. So these are like possible, signs that, okay, there could be some dementia. So you want to check in with a professional. Normal aging, slower recall of information. I can tell you that stress is enough to make us have kind of what we're saying, like neurodiversity now. So we're thinking a lot, we're juggling a lot of things. So even younger people are having struggles to recall information because of life's challenges, but it doesn't mean that you cannot. I read somewhere by a neurologist, a specialist, he says that 97% of all dementias actually can be prevented and can be reversed. And that was very interesting, so that's good news. So inability to recall recently learned information. So let's say you met at the Ghana Canadian Association office and you learned something about, let's say, your pension. A financial advisor came in and said, I would want you to start putting things in order, maybe start having a will, start talking to an expert. Or let's say we notice that some younger people in the family are financially abusing you, and by law, we need to inform your medical doctor so that you're protected. And then you just went home, and then Mary calls you Mary, sorry, I have to mention your name several times. Mary calls you to say, hey, the last time you book an appointment to say that we have to take you to your family doctor to discuss the financial abuse. And you're like, no, I don't remember. No, I wasn't even there. So that will give, a concern, Mary and other people, that, okay, this is actually an issue, with memory. That could be a problem there that we have to look into, because you were there, we saw you, now you're like, I don't remember, right? And somebody might think, oh, are you malingering here? But you're not, it's just your memory. So misplacing items occasionally. So yes, it happens to all of us. This happens to all of us, especially in a generation of chaos. Happens to all of us. So here, putting items in inappropriate places. So as we get older, now you know that you have to put your car keys in one place, a certain place. You put your eyeglasses, So I have to put my eyeglasses in a specific place because if I don't, I can't even see, without them. So then you find me struggling. So it's always in one place. So, but if you keep putting it different places and then you don't even know you're scattered, that should be an issue, a red flag. Then the last one is trouble with multitasking. And then here, getting lost in familiar places. So trouble with multitasking, it's common. And it's like, if you look at the studies now, it has actually created diverse impact. You find a lot of young people, teenagers say, oh, this is multitasking. But once you multitask, you're actually not able to really, really concentrate. But you can multitask on minute, very simple activities, Or let's say you're babysitting. I had a case, I think it's in the Ghanaian community, yeah. Grandmother was multitasking, and then the grandchild just dropped. So that is really, really scary. And so you can multitask, but you want to be careful, You multitask with very minor stuff, not heavy stuff like that. So they say women multitask, so they are cooking and they are doing different things, but minor things. So I don't think you can multitask, you'll be cooking and be ironing at the same time, but you can be cooking and doing laundry. So that's kind of then getting lost in familiar places. So with seniors, these places that you've been to, places that you usually go and get your food items. Now you can't even remember, you're lost. You were, going to downtown. Now you find yourself somewhere heading towards Kingston or something, so that can be scary. And we've had that before. So you look at typical Alzheimer's, you find people with that. I'm looking at the time as well. So now let's look at the courses of it. So the course, are we okay as I go on to the courses?
Yes, we are.
Okay. Dr. Charles, we're okay? I hope not to take a lot of the time.
Yeah, I'm okay.
Okay.
I just wanted to add a few things before you go to the courses.
Okay. So I should go back.
Yeah, go back one or two.
Okay, sir.
Yeah. So sometimes to the presentation of dementia may be a bit different, in that sometimes they may even have word finding difficulties. So if you show them pressing iron, they will say, "Oh, that thing that we used to iron, that thing that we use for the clothes to make clothes nice." Oh, and then they'll be talking around it rather than naming the specific object. You can have that, and then sometimes you may find them pressing inside out or front backwards, and they won't find anything wrong with that. And then sometimes they may even have a behavior manifestations where they become a bit more aggressive, or they may scream at you. And then when it's very advanced, they may not even recognize their own family members or friends. So that happens. And then when it's very, very advanced, they may not even recognize their own self. Also, that happens. That's also part of the spectrum in terms of the symptoms and the clinical picture of dementia. And then sometimes too, as dementia starts or is progressing, you may have actual psychiatric symptoms, like they may start hallucinating or hearing voices, or they may be seeing maybe family members who have died long time ago, but they may be visually hallucinating and seeing them. And I have a patient with dementia. I saw her last month, and her husband came with her and her husband was in so much distress because she started defecating in the hall, the dining hall. She's not even using the washroom anymore. So that's those are very, very it can be very, very distressing for the caregivers, especially around them. They may not be so worried about it, but the caregivers, the family members, it can be very, very distressing. And then I also wanted to mention the Wernicke's dementia. So this is This is caused mainly by alcohol. And one of the challenges that we are seeing more and more, especially in the African population, is that the elderly are drinking more, especially they abuse substances, but they are drinking more alcohol, especially the men. And I'm not talking about social drinking. I'm talking about serious drinking. They are drinking, and as you continue to drink, you may not realize it, but it can slowly slide you into Korsakoff's dementia, and then you start having memory issues and stuff like that. And the thing about when you drink too much is that you don't eat very well, and when you don't eat very well, your vitamins, the food that you eat is very little, and the vitamins are not properly absorbed, and all that also make the condition worse. So just to add a bit of that there. I'm done.
Oh,
Thank you, sir.
thank you, Doc.
That was really helpful. Yeah, at any point, I can pause and then you add. Because, I'm not a medical trained person. I have a PhD psychology. We tend to do more with the behavioral side of things, versus the medical doctors deal with the organic side of stuff. So that's really helpful. So I also want to add, just to clarify, as we go into the courses, so you're paying attention to like how your brain works. So I keep mentioning that the different parts of the brain. So we talk about the temporal lobe, the frontal lobe, the occipital lobe, the parietal lobe, right? And these parts, as we get older, they change. And then you have the left and then the right brain. So the left and the right brain, they all have these 5 parts that I've talked about. And so your left brain, mainly, if you look at it, it's going into your logic, right? Your logical ways of thinking, doing things. So analytical, you have to think through things, you have to add things, do the mathematics, like sit down to put things together. Those part of the brain that you used, let's say when you were in school or when you were working, at some point, there's also very verbal. That's where the language is. It's also factual. So you look at them critically, and you want to say, so which part of my brain is being affected more? Then when you come to your right brain, more or less like your creative mindset. So like creative mindset, things that you love to do. Let's say you know how to play a musical instrument, you like to draw, these parts of the brain, you go into it, your intuition, artistic, and sometimes emotional, and then imaginative. So these 2 parts, they both, get affected in some way. Some remain intact, but as you go along, you start paying attention to yourself. So now we look at the causes of this decline. So we say that Alzheimer's disease is the most common form of dementia, attributing to 60 to 70% of cases of dementia coming from Alzheimer's. And then dementia here says it mainly affects older people. The risk doubles every 5 years after age 65. 1 in 6 people over 80 have dementia. And so we've explained what that is, right? So you hear dementia, you're hearing memory issues with aging, So you don't get confused with a traumatic brain injury, okay? And then now you're looking at the causes. So doctor helped us to look at some, looking at the Wernicke's are coming from overconsumption of alcohol causing Korsakoff. So we look at the medical issues here. So medical causes here, depression, thyroid problems, and vitamin B12 deficiency. And deficiency can mimic or exaggerate memory issues. So I'll explain that. So vitamin D, from research done, the medical world tells you that it really helps to boost with memory. If you look at thyroid affects, part of I would say, your adrenaline, your hypothalamus, which kind of regulates your system, like being calm or flight or fight most of the time. So when there is like excess production of thyroid, it can actually affect your brain because it's like the body is intense, the body is going to a lot of stress, and then depression. So how does depression affect memory? So depression is correlated to, I would say, we talk about 3 or 4 neurotransmitters, but mainly we talk about the serotonin, right? So the serotonin helps us with our mood and also with good sleep. So if you're not kind of sleeping well, you're likely going to have issues with your mood when you wake up. We also have dopamine in a way, even though the studies are saying that dopamine triggers hallucination. Some studies have also shown that a bit of it, like a lower production of it, can also affect depression. Then you have the norepinephrine. So these are all neurotransmitters in your brain. They are chemicals, right? You don't see them, but they influence like how we feel, how we act. So if somebody is having kind of a very flat, emotions, this person used to be so happy, the person used to come to the center, and then suddenly they don't come to the center anymore. They don't hang out with other seniors. They are not involved in other social activities. They are moody, for like a period of 2 weeks or more. And then you'll be wondering what's going on. So such behavior, they don't come out to hang out with others. So imagine you don't come out unless you're like extreme introverts, right? Somebody are watching TV, so that's fine. But this person is not watching TV. This person is not eating well. This person is not sleeping well. This can actually affect your mood. And as it affects your mood, then those neurotransmitters will be all over the place. And trust me, they affect our memory 100%. People who sleep very well, there was a study done, and the candidate for the study is actually a doctor. She's all she did was to reset her sleep cycle. And so when the COVID, happened, she said she wasn't even affected. She didn't get sick, and she's not been sick for 5 years. And all she did was to just change her sleep cycle. She has a very stable mood, so this is very, very, very key. We also have lifestyle, which is very similar. I think doctor can talk more about the medical condition as once I finish with this part. So lifestyle, I've mentioned lack of sleep, so please, just as you get older, you actually want to make sure that your sleep gets to a REM stage. So the REM stage is when you're really, really deep asleep, your body's well relaxed, you can have good dreams, you're not in terror, you're not overthinking, you're really, really relaxed. Unfortunately, a lot of our people don't sleep well, so you want to give yourself like 6 to 8 hours of good sleep. So it means you have to sleep early, sleep at a particular time, so if you're having like shift work as you're getting older, the night shift work aren't good anymore. If you're doing like 2, 3, 4 jobs, they are not good anymore. So you really want to change your lifestyle. You want to kind of start cutting down on a lot of human expectations, I would say, or life events, so you can sleep well. Also reduce your stress. I feel like, unfortunately for us as Africans or Black people, wherever we go, it's like stress is either following us or ahead of us. So we have to find ways and means to reduce the stress. So when it comes to therapy or psychology, one of the things I would say when it comes to stress is setting boundaries. Set boundaries, learn to say no. Culturally, a lot is expected of seniors. And when seniors say no, people think they are being selfish. People think that, oh, it's your duty as a grandparent to And I know it's very hard. After you have raised your own children, now they're expecting you to raise a whole generation. God forbid if you have like 10, 12 grandchildren. It's a joy to be with them, but it comes with a lot of, work. So you want to be gentle with yourself. You want to reduce the stresses and also reduce the stresses by not being the solution to every problem in the community. Age comes with a lot of wisdom. Age comes with a lot of expectations. And I would say that you get to a point where you have to delegate. You have to let people do things on your behalf. Don't be everywhere all the time. Don't be everywhere in every situation. Just keep prioritizing. It helps to reduce your stress, especially with the funerals. I don't understand. I don't even understand my own mother. Like every funeral, I'm like, don't go, but she's there. She said, I won't go, but then she's there. Anyway, I can't do anything about it. Now, diet, poor diet, make sure you're eating very well. I know Mary has once talked about bringing nutritionists. I think she does very well with the team. So please pay attention to that. As we get older, certain foods aren't good for us anymore. Inactivity, move. Oh, okay. I will wrap up quickly. So inactivity, social isolation, negativity also affects memory. Then we have biological issues, neurological changes, reduce blood, reduce blood
Go
flow
to the brain.
reduce blood to the brain also creates that. So, Dr. Charles, I would leave this part to you to add to also.
Yeah, I just want to add. I just want to add that for the vascular dementia, it's caused mainly by modifiable factors. So by that I mean your blood pressure is high. You take the medication for 1 week. This week you don't take it. You're slowly damaging your neurons in your brain. Apart from the other organs, your heart and all that, your kidney and all that. So if you're on diabetic, high blood pressure, you're on medication, just make sure that you're taking these medications consistently. Because it's just not a matter of your blood sugar going too high or your blood pressure going too high. But if you don't manage it properly, it predisposes you to vascular dementia. And we see that a lot more in men than in women. So I thought I'll bring that. And then the other issue is the sleep. So as we grow older, in our seniors 65 plus, we see a lot of sleep becomes more difficult. As you grow older, you may have sleep broken, or you sleep and then you wake up 1 a.m. you can't sleep anymore. And so it's important that you structure things around sleep. So for example, one of the very common causes is pain. So just make sure when you go and see your family doctor that you have a list in front of you. If you still having pain for whatever condition, that the pain is properly managed. Sometimes your diabetes is not properly managed, or sometimes the medication that you're taking, you are peeing like 5 times every night. So you have to, when you go, you have to let the doctor know when I can't sleep because I'm peeing 5 times a night. So the doctor has to modify the medication, either you to take it during the day or to change the medication or stuff like that. Try not to sleep during the day, because when you keep napping and napping, then at night you can't sleep. So try and do active. And partly is because maybe you're retired, you're not going back and forth like you used to do. So you're at home. And I'm glad when I heard that you have activities for the seniors. That's very good. So you join these seniors activities, maybe you're volunteering, maybe at the hospital, at a facility, and that at least part-time, and then that will keep you kind of active so that when you come home, you're tired somewhat, and then you can sleep. And then I'll come back to the alcohol factor again, because we are seeing more and more. If you keep drinking, it affects your sleep. It impacts your sleep, and it breaks your sleep. So taking heavy amounts of alcohol, especially late at night, nicotine, smoking, and caffeine all can impact your sleep. Usually, if you want to take caffeine, you can take it earlier in the morning, not too high quantities. And so I'll leave that. And then the issue about stress. I mean, stress is a whole topic that maybe we have to talk about another time. But apart from setting boundaries, you also have to manage your stresses. Stress, you can't. I mean, driving is stress, so you can't take away stress completely. You can minimize it by avoiding and managing the circumstances around you, as Edna said, setting boundaries, and then also trying to introduce some wellness in your life. So sometimes changing scenery, traveling, it helps reduces the stress. Having even a lot of research shows tactile sensations. For example, going to the spa and having a massage, it actually calms you down and reduces the stress. And even the ladies, when they go to the spa, they are doing their nails and all that. It all helps reduce the stress, believe it or not. So there are various things that you can do to reduce stress. Exercise is very important, and it's important to. There's a recent study which shows that those who don't exercise have higher incidence of dementia. So, and I know you may not be able to run. You're a senior, you may not be able to run, but at least you can walk. So, try and walk, and even if it's winter time, you can walk in your building. You can go to a recreational center. Just walk up and down, but whatever it is, try and, as much as possible, to exercise, if not daily, at least 3 times a week, 30 minutes minimum. That is very, very crucial. And then also exercising also decreases. When you exercise, there's something in your body called endorphins. They are feel-good chemicals. When you exercise, they are released into your system, and they make you feel good. They help heal the body. They decrease the amount of pain. They do a lot of things. So exercise, whether you're young, old, is so crucial, especially in this climate, this cold climate. It's so crucial that you exercise. Gentle exercises, walking as frequently as you can. So I'll just add that for now, and then we can take things from there.
Thank you, Dr. Charles. I think a recent study published this year, they looked at people who walked for 30 minutes, 4 times in a week, for 2 years, were able to reverse, memory loss to about 10 years. So that's a good indicator, just walking for 30 minutes. So now people are asking questions, so I'll just finish. I know that we have up to 8, and so then we can answer all the questions. So I'll go through this quickly. Doctor will add his, and then we'll go into prevention. So here I just look at a few things about culture and genetics and gender related to some of the questions in the chat. So somebody was asking, when does it start? It's 65 years plus. That's the clinical definition of somebody having dementia. Are children likely to be diagnosed with Alzheimer's? No. It's an aging disorder. It says if a child has ADHD in their childhood, is there a possibility that they would have dementia? So like we know what ADHD does, hyperactive, inattention, and impulsive. So these are like the three diagnosis criteria of ADHD. So if somebody is hyperactive, impulsive, and inattention, as they get older, the research has shown that when we getting older, we become less impulsive. So the inattention is there. So you find people kind of missing little things on their documents. That is there. And also hyperactive, people become less hyperactive. And so the prefrontal lobe, which regulates Alzheimer's, ADHD, it's more or less regulated. So as they get older, thank God, as we get older, we have different coping strategies. But from what we have presented and what Dr. has said, there are other predispositional, behavioral kind of lifestyle or activities that we engage in that are, kind of more or less put us in a situation where we might start having these memory deficits. So as we get to the Q&A, I'll leave that to Doctor to add. So here we're looking at some fun facts. Global studies show that dementia prevalence can vary by region, genetics, and socioeconomic factors, and not just race. So people might think, is it common in Africans, more in white people? So if you look at the studies, it shows more in white people because they have tools, they have access to places where they can be diagnosed. So like I'm telling you, I don't even know how to literally tell a family member to say, I think you may be having signs of memory decline. Go and get yourself tested. Even with all my education, people in my family still don't believe in psychology, trust me. So imagine the regular folk, the ordinary person. So it means that we need more education in our culture. We need more education in our community. So here, diagnosis to access are quite accessible. In African Americans, like Dr. Charles said, he's working directly with people like that, diagnosing them. So in psychology, we have psychological tools that we use to look at memory issues. We use the Stroop, we use the WIMPs. Sometimes we use the Wisconsin, but doctors have their ways to test that. And so they can tell you that there's delayed diagnosis, misdiagnosis, which is quite common, fewer treatment options, cultural stigma around mental health. So this is a big issue with
It seems like you're recounting
this is a big issue, with our community. So the second thing we've talked about genetics in our community. The slides will be made available so you can have them. We talked about lifestyle. We talked about stigma, we talked about perception. So the take home here is that this is something that is not specific to a particular culture. It affects all human race. It affects all regions, irrespective of, the genetic dispositional factors, your lifestyle, or where you find yourself, or a life issue like stresses can put you in the place where, you start experiencing memory decline. Do we all experience it as human beings? Yes. When it comes to gender, the research shows that, older women tend to are more predisposed to memory decline than men. And the factors here, they are saying hormonal changes. So when women get into menopause and postmenopause, hormonal changes affect the brain, or because women tend to live longer. That's what the research says. So here I put that in the table form. You look at Africans versus whites, and then you can also look at that also when this is shared. But you pay attention to this gene, APOE, which is quite common in Africans. When I was doing this research, I've seen this Alzheimer's gene. I didn't know it was quite common in Africans. So that's what they said. The studies shows that this is common in Africans than in white people. So interesting. So here, preventative strategies. So we've talked about it, mental exercise, playing puzzles, engaging with others, talking, don't isolate yourself, physical activities, just walking, a lot of studies on walking shows great results, on memory, social engagement, not just funerals, but different social engagements where you can do beatings, I remember when I enrolled my mother in some social activities in Ghana, people were they thought, oh, what are you introducing to her? But now, you know, other older mothers have joined, and it's quite interesting. They meet, you know, twice a week. They learn different languages. They do beatings. They do different things. They walk. They do the exercises. You know, I watch the videos, and they're doing all the relaxation things that Dr. mentioned. The healthy diets, omega-3 is very key. Look into it, talk to your doctor. If you can't get it in foods, get the supplements. And the key thing here is try and be organized. Have a little notepad. Have a little notepad here. You carry it with you everywhere you go. You write things down. You have your calendar. It helps you to organize. Don't say, I'll do it tomorrow. Just immediately pay attention to it. So this brings me to the end of my presentation. I know time is running so fast, so that's why I'm also running through the last slides, but I'll leave it for Doc. I'll go back and then he can talk
Yeah, I
about.
just want to add that for Alzheimer's, about the children getting Alzheimer's, yes, it's a disease of old age, but for clients who have Down syndrome, they get it much earlier. Not still as children, usually around 40s, then you see they start getting demented. I've seen one around in their 30s. So just to so if someone has Down syndrome, then their doctor have to look out for Alzheimer's much earlier. Sometimes ADHD, it doesn't predispose you to dementia, but people with ADHD, they are very impulsive. They may get head injury through trauma, impulsive behavior, and through the trauma indirectly, they may, but their correlation is very low. And dementia in Black people is being more and more and more recognized. One of my very good friends who also went to Pokuari in New York, his mother developed dementia in Ghana. So I went to Ghana and I visited her at Kolebu. And I was speaking to the doctor who was there, and the doctor was telling me, oh, they're getting lots of cases now. So now we are looking out for it. Maybe I believe it was there, but we were not looking out for it. Now we are looking out for it. It's been diagnosed. So don't think that, oh, it's a disease of white people, so Black people can get. If I have about 10 dementia patients and 8 of them are Black. So it's common in Black people. And then the issue of stigma, very, very important. I know that as people of African origin, we prefer to speak to our pastors and traditional healers and elders and all that, which is good, rather than speak to a doctor. But there's nothing wrong in prayer, combining prayer with medical care and getting the best of both worlds, because it's something that we see quite often. Lots of prayers, they don't even, go and see their family doctor. The issue becomes very, very, complicated, and then they rush to the hospital. So please, once the issue comes and you're talking to a pastor, start talking to your family doctor straight away. Combine the best of both worlds, deal with the spiritual, deal with the physical. I think, yeah, that's what I would add. Any questions? Any more questions?
Yeah, I put a question on. Is it inherited?
Yeah, so dementia, especially the Alzheimer type, may run in families, and Huntington's too may run in families. So yes, but you may have someone who hasn't got any family history who may develop dementia. But there are people who also have it in their family, and it increases the chance of developing dementia, especially of the Alzheimer's type and Huntington's disease.
So if you have a family history, that's like a predispositional factor, right? So if you know that already, you look at the seniors in your family and you see the pattern, then you know that you're predisposed. then it means that you have to start taking cautionary measures to delay your memory decline or start preventing it from happening to you, just like diabetes. So diabetes ran through the Black families. You know, for a long time, it was perceived as, you know, witchcraft, witches are trying to suck your blood or something. But now we know it's a medical issue. And so now people are beginning to take cautionary measures. Okay, let me reduce my carbohydrates. So it's the same thing with the dementia. You get the table and then you look at the different types, right? So there are some that are like direct family stuff. And you can, I know people have like Alzheimer's in their families, you know, in Ghana. And they are doing things now to prevent it because they've seen it in their parents to prevent that.
Yeah, and I also want to touch. I know we wanted to focus on Alzheimer's, but I also wanted to talk about depression in old age briefly.
Okay.
That is quite common in the older the senior population, for various reasons. You may have lost a spouse, they are lonely, they have friends that they confide in, they have died, you know, they'll be living alone and feeling isolated. And then other factors, health issues, chronic pain, sometimes even financial issues. And so all these things may make you begin to feel depressed. And sometimes in our culture, we tell them to push through and and stuff like that. But sometimes it's not just feeling temporarily down. It may actually be signs of depression. When they're losing interest, they're not sleeping, they're feeling hopeless. And sometimes it even leads to suicide. So once these things come up, have a conversation with somebody, speak to your family doctor. If it's just, you know, a temporary dysphoria, they will let you know things you can do, social interaction and stuff like that. But sometimes it goes beyond that, and you may actually have to get treatment for the depression. So it's not just a matter of being strong and pushing through. Help is available, and it's possible to, healing is also possible. So don't hesitate. And on that note, I also want to mention that for those of us living in Brampton, they've opened the Black Health Hub for those in the Peel region. It was just last week. It's the Black Health and Social Services Hub. It's based at Peel Memorial, not Brampton Civic, Peel Memorial. So this hub is something new. It's following advocacy by mostly the Black staff at USLA. It's meant to promote health and outreach for the Black population. So there's education, there's counseling. If you don't have a family doctor, they can direct you to where you can get a family doctor. And it's not just mental health tools. Like if you have physical health issues, diabetes, struggling with cancer, any other issues that specifically affect the Black population, they are there from 9 to 5 Peel Memorial during weekdays. And it was just open last week. So once you get to the reception, you just ask them to show you where the Black Health and Social Service Hub, and they can support you with these kind of issues. And I know Ghanaian Canadian Association is also doing a lot in that regard.
Okay.
Doc, if you can get us a phone number, I'll put it on the platform later.
So they decided not to use the phone number because they want you to come.
Oh,
so
okay.
they didn't attach any phone number to it. You walk to the reception at Peel Memorial, downtown Brampton, ask for the Black Health Hub. If it's a weekday between 9 to 5, they'll direct you, and then you can talk to somebody and they will direct you to the resource that you need.
Thank you, Doc.
So there are two questions. One is asking the threshold. I think the person is talking about prognosis from what I got from the question. So we said the decline start happening after 65. And then once you get to 80 years, it's like every 5 years, it gets worse. So if the person is asking this question, this is the answer. So the best thing is preventative strategies before you get to that point. So you get into your 60s, exercising, dieting, taking your vitamins, engaging in all the social factors. And then the second question on if education level is a factor. So the studies have shown that actually having like rigorous education helps to preserve the brain, part of the brain. So if you are here from the beginning, we talk about both the different types of the brain, and the functions that you know they play. So if you are like heavily involved in education, depending on if it's higher education, your brain requires you to use a certain part of the brain more, right? So more or less like your left brain, analytical, logical, and then you have part of your right brain being in the creative piece, emotional piece of your right brain. But also if you've had trauma, childhood trauma can also be a factor as you are kind of growing. So it's good to get early intervention. Also, the type of education that you had in your childhood also helps to preserve part of your brain. But overall, higher education tends to help people return back when it comes to intervention to normal memory. If you look at the table, we look at normal memory and then abnormal memory, which is like dementia. So higher education helps you to return back to that level of normal memory. There could be some level of forgetting, but it's not as extensive as dementia. So that's my answer.
Yeah, just
Thank
to
you,
add
Doc.
that
At this point in time, I think I will let Dr. Charles Ohendakun present his, and we will go up to 8:30. We will go up to 8:30. So if so I will let Dr. Ohendakun give us a little bit, and then the question and answers will follow. We'll go up to 8:30.
Doctor, you are muted.
I'm muted.
Sorry, I'm so sorry. Yeah, so most of the stuff very similar to what Edna has discussed. I think somebody has a question which says that the average expectancy. So first of all, the average expectancy for anyone living in Canada is around 81, and that's the average. I mean, you may cross it, but most importantly, when someone is diagnosed with Alzheimer's or with dementia, there's treatment available.
Lips is not here. No. He's coming. He said, he told me he'll be here by 6:45, 6:30, 7:30 or 7:45.
There's treatment
Mute yourself, please.
Yeah,
Mary, please unmute everybody.
Is a question and answer now because I know Akwesi was talking. I just muted him.
No, I want Dr. Ohendakun to present his before the question and answers come.
Oh, okay. Go ahead.
So what I was saying was that most of the information has been presented by Edna, but I just wanted to add that there's treatment available if somebody becomes demented. The treatment slows down the progression of the dementia. It doesn't completely reverse it. There are a few ones which may be modified, but largely, especially with Alzheimer's, you can't really reverse it by so many units. So that is another reason why we have to make sure that we take steps to prevent us getting into that phase. There are various treatment. I don't want to go into the various treatment modalities, but there is medication available that we use to slow down and stabilize the rate of progression of the condition. These medications work on, as Edna was saying, these chemicals in the brain, acetylcholine, serotonin, dopamine. And then once there are other behavior symptoms attached, we also manage the behaviors. Sometimes it may not just be the memory issue. Sometimes they may start hearing voices, they may be hallucinating, they may become aggressive and stuff like that. And there is medication for all that. So it's never too late. Once there's a diagnosis, we tend to treat, and we tend to support the family as well. The Alzheimer's Society of Canada is very, very supportive. So if you have a family member who has Alzheimer's, don't hesitate to contact the Alzheimer's Society. They are very, very supportive, and there are various other societies. If you speak to any social worker working in that area, they'll be able to provide you with the resources. Somebody said, why should I don't know, God is in wisdom, human beings live full lives by enjoying what is on earth while he controls the rest. Why should we worry then? Yeah, we don't have to worry, and worry is no good. But at the same time, we also have to be smart and make sure that we are doing the right things to prevent any further deterioration of ourselves. So it's not really a matter of worrying, but making sure that you're doing the right thing. You are not, drinking too much alcohol. You are not sitting down, not exercising, and just waiting for life to happen. If you're not sleeping, you're not just sitting down, you're trying to do something about it. For example, social interaction. If you're interacting socially, it actually boosts your immunity by 10 to 20%. So just being able to interact with others, go to seniors group or events, talking to people instead of retreating, because usually when we become stressed, we tend to retreat. We call them maladaptive coping mechanisms. When people become stressed, they don't want to talk to anybody. So some people, if the phone rings, they don't want to talk to anybody. But actually, when you're stressed, that is the time that you have to talk to somebody. And even the Holy Scriptures tell us to help carry each other's burdens. So it's important that when you are when you have stress going on, that you open up to somebody. It could be your pastor, it could be your best friend. As I said, the issue with the seniors is that sometimes the person that they confide in may have died or may not be available, and so they feel feeling that loneliness the more, and that's why it's important to join groups like the GCAO. Any other questions coming up?
Can I speak through the audio?
Sure.
Yeah. So probably this might be a bit off, but I just want to ask: is it true that when you are diagnosed with dementia, at early age, and you want to become a nurse in America, you can't do? In America or Canada, is it true?
So that would be very late, because most dementias are 65 plus. So if you're diagnosed with dementia, where are you going to get the capacity to learn? Because training to become a nurse is a very intense thing. You need your working memory, all the memory that Edna was talking about. You need those faculties to be intact. So you will struggle if you're, and sometimes you may not even be, we may have to even pull your license, your driving license. So I don't think there's necessarily a ban, but there's going to be a big struggle and for you to be able to complete the course.
Okay.
Depression is different. I mean, when you've had a bout of depression and it's been treated,
yeah,
you can train. You can train to be whatever you want to be.
Yeah, I'm sorry. Not dementia per se, but I wanted
depression.
Depression, or if you have any problem with your mental health and you are diagnosed, because there will be a record on it, right? So they might think if you are a nurse, or you could go into crisis or episode, and then you might not act well. So not dementia per se, but anything related to mental health.
Okay, so previously it was different. Over the last, I would say that at least the last 7 years, the criteria is this: that are you, if you have a mental health problem, is it being properly managed? And are you confident that it will not interfere with the job that you're doing as a healthcare practitioner, as a nurse? If it's properly managed, you're taking your medication, and the symptoms are not interfering with your functioning to be able to function, then you can do it.
Thank you very much.
But every year, the College of Nurses or the College of Physicians, they will ask you, they have a form that you have to fill. I've just filled mine last month. They ask everything. Do you have, are you using drugs? Are you using everything? You have to go through everything. You have to be very transparent to them, because if they find that you're lying, your license is off. So you have to be very transparent. You tell them, I have a mental illness, it's being treated by XYZ. Sometimes they may ask for a bit more information from your doctor, but if they feel that the symptoms are under control, your doctor is supporting you, you can do your job. You may ask for accommodations at work, but you can do your job. I don't know where, Edna, you want to add anything.
Oh, yeah, I just want to say that everything you said is right. So you can disclose, and there's absolutely nothing wrong. And then you get the required accommodation. And once you're getting treatment, you're fine. Yeah.
So maybe I'll just add a few tips on mental wellness. I know, and that's for all of us. So that is also quite important. As you know, stress cannot be completely eliminated. When you're driving in traffic, you're stressed. You go to work, there's stress. So there's stress everywhere. But you have to learn to minimize the stress. And there are certain things that you use to cope with the stress. There are positive coping skills and what we call maladaptive coping skills. So, for example, so people, when they're stressed, as I mentioned, then they isolate themselves, they retreat, and then the loneliness makes it worse. You keep brooding, and then it makes the whole situation worse. Also, people, when they're stressed, they will start using alcohol or substances to try and cope. You don't blame them, but they feel that that's how they can cope. But there are other things that there are more positive things that you can do to try and deal with the stress, like talking to somebody that you can confide in, like even exercising. It helps release endorphins that can relieve the stress. And there are also things that you can do that can also make you a bit more resilient, so that when stress comes, you can handle it better. So these are things that, for example, these are the 5 senses of the body. You can make sure that you are making sure that you boost it up. You fill up your 5 senses and boost up the 5 senses. So, for example, one of the senses is touch. So I talked about going to the spa, pampering yourself, sometimes even hugging. All that, it helps your immune system and it helps your resilience and ability to cope mentally. Even visually, if you like going to a museum, going to see works of art, traveling outside, sometimes you travel, change of scenery. All these factors help you watch a movie, excursions, as the seniors mentioned, they go on a cruise. All these things help you boost your resilience and your mental wellness. And then even the taste, eating good food, not just quantity, but good quality food. And that's one of the things the French are known for. Good tasting food can also help boost your immunity, as well as help increase your resilience. And even smell, the sense of smell. I remember one time we went for a conference in Czech Republic, Prague, and it was a medical conference. So the place was very, very, you had a sense of very extreme calm. And I didn't know what was happening in the hotel. This was it's a big hotel. So in the evening, the doctors, after the talks, and we gathered and we were just, hanging out at having some drinks and some finger food. And then we started talking about the place. There's some calmness in this place. And then we realized that there was a smell in the hotel which was very soothing, very nice. And I don't know whether they used it in their cleaning material or whatever, but it kind of calms you down. And we're talking about how powerful these experiences can be. So sometimes even using some nice perfume, it won't just be impactful on other people, even for yourself. It may have a good and soothing effect on your well-being. And then obviously the hearing, soothing your ears, good music, calming music, hearing good things, they all have a positive effect. As we say in our language, asumji, like in your ears. It's not just the peace of mind, but having soothing sounds that would calm your brain and calm your mind. The reassurance of music therapy, integration of healing sounds. You can get that. Some people will go to church and they'll say, "Oh my God, the praise and worship was amazing." And sometimes it's not even just it's not just the connection that you're having spiritually, but it's also the sound, the soothingness of the sound, the soothing of the sound. So these are some of the ways, in addition to all that we've spoken about, the sleep, the exercise, the nutrition, and all that. These are some of the things that you can do. And don't think it's foreign, or we Black people, we don't do that. No, it's important that you learn to pamper yourself and not send all the money to the family in Africa. It's important. I mean, it's good to help people back home, but sometimes you have to think about yourself and take care of yourself so that you'll be able to take care of other people. I'll pause there. And is there any questions?
Okay, I think we will ask two more questions and then we will wrap up. So, you can put the question on the chat or raise your hand and I'll let you talk.
So whilst we wait for the questions, I just also want to add to what Dr. Charles said. So aging is part of life, is normal. And as we age, it comes with challenges. And one challenge is on the brain. So like I said, those who came later, this is the brain. I show the picture of it. I have this in my office all the time. This is the human brain. It's in our head. It's one of the most vital organs in the body. So do not neglect it. Everything that we've talked about, you can either use it to help to decline and reduce the dementia from happening, or you engage in a stressful life that will push the memory to decline faster. So that's what I would say. It's part of us. You can prevent it, or you can push yourself into that place. Thank you.
Any questions?
Yes. Good evening, everyone. I have the question on the chat, but it hasn't been addressed, so I'm asking it.
Okay, go ahead.
Yes, can reading a lot slows down mental decline, especially in old age, like if you love to read? Do you hear the question?
Yeah.
Yeah.
Dr. Charles, should I take it or you take it? It actually helps. So reading actually stimulates your prefrontal cortex, your temporal lobe, so it's good. You're actually engaging your working memory as well.
Mm-hmm.
And then you're pushing information away from just forgetting to actually being in that working memory. That's what we want to do in the working memory most of the time. So it's good. Thank you.
Thank you.
And in addition, I would say sometimes even doing puzzles,
mm-hmm.
anything that would work your prefrontal cortex, your frontal cortex.
Mhm.
It's helpful.
Very good. Our quiz master, Nana, also is good at that. He gives us quizzes every week. And those who are doing it, you can hear doing the quiz helps a lot because it keeps your mental faculty from declining because you're always in the brain, as the doctors are saying. So we should do the quiz.
Hello, everybody.
Thank you.
Okay. In the absence of that, I think I'll ask Mrs. Frisha Boche to give the vote of thanks. But before then, I think there's something that she's not aware of. And so I want to address it before she gives the vote of thanks. Is Mary Ekwamwa still on the line?
Yes, I am here.
Okay.
I need to say a very big thank you to you. Mary just flew in from Africa.
Okay.
You know, he started talking to me even before he got home. Okay, she's been on the end, so I know Mrs. Butcher doesn't know that. So Mary, I just want to say thank you very much for all you do to help your seniors.
Yes. Thank you.
Okay.
Thank you very much, Mary. You're always there whenever we need you.
Thank you all.
Yeah.
It is by God's grace we're able to do all of this. And so, yes, it's a pleasure to serve our seniors for sure.
Amen. Thank you.
Okay, so Mrs. Butcher, I will leave that to you to give the vote of thanks.
Yes, and before I do that, our seniors who are on the platform, you know that as the doctors have said, activities, we've put a lot on our platform, the seniors platform. And then as summer is here, we are getting ready to take a trip. And then also we will have our picnics. So we have a lot of activities around. But we've seen that participation is not that great. So please come aboard. It's for our own good, so that we can stay around longer to see our grandchildren and great-grandchildren. So I thank you all, those who are on the platform. So on behalf of the seniors group, ECO seniors group, and everyone who participated this evening, I would like to extend our heartfelt gratitude, big heartfelt gratitude to Ms. Edna and Dr. Charles for their excellent presentation. We've learned a lot this evening, and we hope that we can have them all again, and also to have a number that maybe some of us want to reach them later on and ask questions, or help our other seniors on the platform. It will be available to us. So I thank you very much. You've done excellent presentation, and we are very grateful. Thank you, everyone.
Thank you, Mrs. Butcher, and
thank you.
I would just say thank you to everybody.